Good afternoon. Thank you for joining us and welcome to the 2020 BBC Monthly Health and Safety Conference. As mentioned in the emails and packages you all received, today's discussion is about preschool age children, aged 3 to 5 years old, and we will be talking about what makes a specific age group at a higher risk for injuries and accidents like falls that can lead to concussions. We have a case study, an example of a preschool age child, Dora, that had an accident and fell off her tricycle. Dora then developed concussion symptoms and was brought into the emergency department. As we read this case study to you all, we will then go into more detail and discuss why preschoolers like Dora are at a higher risk for falls and concussions. Then we will talk about the signs and symptoms of concussions due to falls and how concussions are treated and handled in the hospital and at home, along with some safety and precautions to help parents and children prevent these injuries from happening in the future so they don't end up in the hospital like Dora. Dora is a 5-year-old female whose parents had brought her into the emergency department at Bow Valley Hospital. She had an accident while riding her tricycle at home, possibly falling off of it and hitting her head. Her parents did not witness the fall, but noticed a few changes in Dora's mood and actions from the possible accident. Her mood immediately changed from a happy, smiling child to a crying, screaming, and very irritable child. Her day history showed increased vomiting of 3 times in the last 4 hours. Dora was not really aware of her surroundings. She was mumbling her words to her parents and could not make full sentences like she usually does. Her parents reported that she keeps shaking her head and holding her face. Hands are covering her eyes, and Dora keeps crying nonstop and seems to be in a lot of pain, and is very irritable to light and sounds. Falls that lead to concussions, like what young Dora has gone through, are the leading cause of injury-related hospital admissions and emergency visits for preschoolers in Alberta. The preschool age group is from 3 years old to 5 years old. These children are at very high risk of getting concussions from all sorts of different injuries and accidents. They seem to suffer from a lot of different types of falls, tripping over themselves and playing really hard without having the senses of conscious awareness of their surroundings, which relate to hitting or banging their head on the ground, which can be from the sides of beds or furnitures or just anything outside. Preschoolers have no fear at this age and are trying new things out all the time and are very curious at this age as they become little daredevils, trying to mimic what their older siblings or family members are doing. This makes them more prone to getting into accidents, anywhere from riding and falling off tricycles to playing tag inside or outside of the house. Simply just being curious and falling, trying to reach or look for something. Whatever it is, it doesn't take this age group much to have an accident and hit their heads, causing some type of head injury like concussions. Preschoolers' bodies are changing rapidly and starting to develop more muscle and coordination. The problem is their heads are still much bigger than the rest of their body, and this causes their coordination and center of balance to be thrown off, which also leads to their head being the heavier and first thing to always hit the ground rather than any other part of their body, causing a lot more head injuries like concussions. My name is Kevin Webinger, one of the licensed practical nurses that works at Bow Valley College Hospital. I'm here to present this information to you all with the help of my wonderful colleagues, also licensed practical nurses Erica Leskowicz, Abraham Adim, and Janima Philip Abraham. We hope that you can all take away some key points to help educate parents and kids of all ages, so that these falls and accidents can be prevented or minimized in the future. First up is Erica, who will go into more detail about how falls involving the head can develop concussion and what exactly concussion is and why it's just such a concern to know what the signs and symptoms are. Erica, the floor is all yours.
Great. Thank you so much for that lovely introduction, Kevin. Hey everyone, my name is Erica, and I'm going to begin by explaining what a concussion is. So, a concussion is defined as a type of traumatic brain injury that is caused by a blow to the head. There may be visible signs such as bruises, scrapes, or cuts. However, there also may be no visible signs. When experiencing symptoms, they can be categorized as mild to severe, and the duration can be hours to days and even as long as weeks. Keep in mind that when children hurt themselves, they can't necessarily describe or find what they are experiencing. There are 4 general categories of symptoms, and I'm going to compare what an adult may experience versus how these symptoms may manifest in children. The first category includes thinking and remembering, and some indications of this would include not thinking clearly, feeling slow, having trouble concentrating, and not being able to remember new information. Some physical symptoms would be balance issues, headache, nausea or vomiting, blurry vision, dizziness, fatigue, and sensitivity to light or noise. A concussion can also affect a person's emotions and mood. They may seem easily agitated, sad, anxious, or nervous, or overall emotional. Finally, their sleep patterns may change, like they may be sleeping more or less than usual, and they may even find it difficult to fall asleep. Again, it may be difficult to pinpoint if a preschool age child is experiencing symptoms. Sometimes symptoms won't even be easily recognized as a symptom of a concussion. Some examples of these include your child is crying more than usual, a change in the way they act or play, having trouble concentrating, crying repeatedly, and changes in their eating or sleeping patterns.
Hello, my name is Ibrahim. Depending on the severity of the concussion, children can be treated at the hospital or sent home with doctor's instruction. Parents should watch out for the symptoms that Erica had previously mentioned. However, immediately call 911 if your child is experiencing severe symptoms such as repeatedly vomiting, slurred speech, they lose consciousness, one pupil is bigger than the other, or if they are having convulsions or seizures. There are a few guidelines that parents can follow to help their child recover from mild concussions at home. One way to reduce swelling is to use ice or a cold compress on any areas that are swollen for 10 to 20 minutes at a time, but make sure you put a thin cloth between the ice and the skin. You want to ensure your child gets plenty of sleep, and it may help to keep the room quiet, dark, or dimly lit. Ensure your child goes to bed and gets up at the same time each day. Make sure you limit foods and drinks with caffeine. If your child is experiencing nausea or vomiting, stick to a clear liquid diet. Limit any activities such as housework, homework, and especially screen time. Avoid giving your child any other medication until your physician deems it safe to give. However, you can try kids Tylenol if their headache persists. Watch that your child doesn't engage in any other risky behavior that can cause another potential head injury, and monitor any changes in mental status. Gradually allow your child to get back to their normal level of activity. All these interventions can help treat your child's concussion, but if you suspect your child has a concussion, always consult your physician first. Thank you.
Hello, my name is Chidinma. I am discussing some measures that have proven to be effective in preventing injuries. The best prevention of minor or serious injuries like a concussion is the knowledge of age-appropriate risks. Parents who understand their child's activities at certain ages, Prevent many serious injuries by guiding them and taking necessary precautions. Play activities for a preschool child increases in complexity. Safety rules are most effectively done by good example, and they often contribute indirectly to the safety of others. Some of the safety rules from Alberta Health and Safety highlight the following guidelines to ensure low-risk management of child-appropriate play activities. These guidelines include teaching your child to participate in age-appropriate activities, teaching your child playground safety rules and the importance of staying consistent with these rules, using playground equipment that is age-appropriate and that your child can reach or climb on their own. Make sure you are supervising a child during playtime, and supervision is recommended until the child reaches 12 years of age. Make sure you're teaching children street safety rules that will help them know when it's right to cross the road safely. When it comes to explaining risks to your child, make sure you use clear, understanding language. Do not scare them with dangers, but do tell them the truth. As a rule of thumb, it's best to let them say your safety instructions back to you to ensure they understand. When it comes to staying safe at home, remove furniture such as cribs, beds, stools, and changing tables away from windows, and make sure you have a lock device on the windows. You want to ensure that windows are not more than 10 centimeters or 4 inches when they are open. All these safety points are critical for ensuring the safety of your child. R.
Younger kids like that are very resilient, and it's the same warning signs that we look for in adolescents, in young adults, and even in adults. If there are signs like increased drowsiness, nausea, and especially vomiting, any associated seizure activity, any cranial nerve problems like abnormal pupils, any of those other signs or symptoms that go along with the injury, then that's more of a red flag and something that should be checked out. But kids are kids and get these bumps on the head all the time, and far and away, those are benign injuries.
What is this danger that threatens your children's safety? It's falls in the home. That's right, falls are the #1 reason young children end up in the emergency room. You might think your home is the safest place, but the reality is that most injuries to young children happen in the home. Falls on level surfaces, like tripping over toys, falls from beds, and falls downstairs, usually because of missing gates, are the 3 most common causes, and they're all preventable. How can you keep your children safe? Active supervision is the best way. Be aware, keep your kids within sight and within arm's reach, and be a good role model for them. Childproof your home. Go room to room to check for possible dangers, and get down on your hands and knees to see things from their perspective. There are lots of other ways to prevent falls in the home, and you can find out more at healthunit.com/because. Predict the dangers, prevent the injuries, because injuries are predictable and preventable.
Babies grow so quickly and move to explore the world. As they learn to walk, they fall a lot. Here's how to fall-proof your home. To identify hazards around your home, take time to get on the ground and see the world through your child's eyes. Install stair gates at the top and bottom of staircases. Hardware-mounted gates should be used at the top, and pressure-mounted gates can be used at the bottom. Install window stops or window guards, and place furniture, such as side tables, couches, and cribs, away from windows and balcony doors. Place car seats and other carriers on the floor, never on top of furniture. A baby can easily roll off a change table. Always keep one hand on your child when they're on a high surface. Buckle your child in their high chair every time they sit in it. Same thing goes with their stroller too. If you follow these steps, you can have a fall-proof home. To find out more, visit parachutecanada.org/SafeKidsWeek and follow #FallProofYourHome.
Out of your busy schedules to join us and listen to our presentation on how to prevent preschool age children from falls and to hopefully see the signs and symptoms of concussions if your child happens to have an accident. Hope this will help in making you feel a little bit more prepared if you're ever in a similar situation to that of what Dora and her family went through. Remember to keep environments safe and make sure to have as much proper supervision as possible for your preschool age child so you can help minimize and hopefully prevent falls and concussions from happening altogether. If you have any questions, please send one of us an email or call our office. We will be more than happy to answer and give you any information that you're looking for or need. At the end of this presentation, please log in to our website and fill out the survey for what we can do better and improve for next time. There is a grading system from an A+ if you liked it and learned something new, to an F if you found the information boring and not helpful. We love to hear from you and hope you enjoyed it. And hopefully you can take away some good things from this presentation. Thank you and have a great day.